All right, we're live.
Okay, we're back after a little break. So, Committee H315, uh, it, there's a lot here that we could do, and there's a lot in the bill. Of course, appropriations will be looking at it from the where the money is coming from, and they'll be considering, uh, as you could hear from Stephanie, and what their usual process is to consider if there are things that are going to be happening that will require ongoing funding after the one-time spending is finished. So I think we need to think through the policies that we want to support in the fast track piece. There, everything there is critically important and more. So what I'm going to suggest is first your thoughts, open it up for a little bit of discussion for the next couple of minutes. And then when Jen comes in, we're going to just go through S24 again. We can come back to our discussion of H315. I'm hoping that we'll have some time Friday. I'm not thinking there's going to be a whole lot of time to do much of anything tomorrow except S20, the PFAS bill. So just open it up for discussion. Josh, you have your hand up. Go ahead.
Yeah, thanks, Senator Lyons. I like, that bill has a lot of things in it that make a lot of sense to me right now. But I think you nailed it when you brought up the fact that it doesn't address our nursing homes or long care facilities. And any type of funding that we can find or anything that we can do to help these facilities, it's stuck with me. Probably back in the middle or late January, we heard testimony from someone, and that individual said to us that by the end of 2021 or by the end of 2022, there's going to be like 40% less long-term care and nursing home facilities in the country. And I have a immediate family who unfortunately reside in nursing homes, and these places are suffering, and anything we can do to give them a little bit of help I think would go a long way for these places to ensure that there is some stability and longevity. They're also hurting for staff. These places can't hire enough people to work. So anyways, I like your thought process on doing something for long-term care facilities.
Yeah, thank you for that. I think there is a letter from Kim Fitzgerald on our webpage. I asked Nellie to put it there. I asked the long-term care facilities for information that would help us in the both the short term and the long term. And so I think it's the third paragraph of that letter that really explicates the immediate need. There is a paragraph in there about reimbursement rates that are more of a long-term base payment issue. Uh, but so that was the question that I asked of Stephanie Barrett. I think we'll look for that her response. If there is a way to use some of the housing dollars, the rental dollars, to support these people and these homes, assisted living areas, we really, I agree with you. Look, we're all getting older. We have an aging population. We can't afford to lose. We're going to have to gain. So, uh, Senator Hooker, go ahead.
Thank you. I certainly agree with that. But I'm looking at the reach up section, and
Hmm.
I'm glad Senator Hardy brought up the base funding because, as she said, it happens every year. We talk about improving that, and we don't. So it's time that we look at that. But before that, I think Erin said something that really struck me. She said even small increases in a year can have a lasting effect on kids. And so here's one of those things that can happen now that we can put money into that will, even if it's kind of theoretical or whatever, have a lasting effect. So I'm certainly in favor of
Yeah,
whatever we can for reach up to help families.
I'm wondering if there's a way that it was the comment was $1,000 a year that goes a long way to provide long-term success for kids. Um, I and I do know that the last time we looked at Reach Up, there was a strong interest on the part of appropriations to spread the dollars further, and so it went to SNAP. But given the support that we currently have for within our food programs, I just wonder if it's you know it's double support in the food area and insufficient in other areas. So I agree with you. I think we need maybe in our letter of recommendation to hold firm on some reach up dollars for these folks. I don't know what do others think. I hear Senator Hooker and we heard Senator Hardy on this. Senator Cummings, your thoughts? You're muted.
I think this is an area where we need to tread carefully because, to give $1,000 worth of one-time money, families at this level are going to come to depend on it, and then it's not going to be there next year. And so, if we can find something specific that will last them after this year, it would be better. We need to raise the rates, but the governor has not put anything in ever. I believe appropriations got a small raise, but it was like the first time in 8 or 10 years, a couple of years ago.
Yeah, right.
And the same with the mental health workers. We put in money to get everybody up to $11 an hour. Was that it?
So, was it 11 or 13? You're talking about
it was
the
below
DAs.
15.
Yeah, it was low.
Those are ongoing expenses, and I think we all know everybody that works for the administration supports the governor's budget. And so, but it's an awareness to have, but I know they're going to be really careful and appropriate about putting money in that they know is not going to be there in 2 years. We're going back to the 30% gap in 2 years.
But that's the question, what reductions have these families seen during COVID? I mean, some of them work.
They have a work requirement.
They have a work requirement. What's happened during COVID? Has that work been available to them? I don't know. So, or is this simply money that helps pay for utilities and other things that they've always had a hard time paying for? I mean, that is the question.
What was said, and her name is slipping, is that the rummage sales and the Christmas Santa things that these families have depended upon, because their kids grow as fast as anybody else's, and the clothes that fit last year don't this year. That's one thing you can say COVID caused this, and therefore it's depending on how the restrictions come down.
Yeah.
That we can do. And I assume they're going to need new summer clothes.
Yep. Okay.
That's a way to get some money in, which will probably meet the present COVID restrictions.
Right. I think, and that is, you're right. It's a replacement funds we're looking for.
And Senator Lyons, I think you mentioned technology when we were first talking about this. And
Mhm.
what about kids who don't have the technology that they need to keep up with schoolwork and stuff? So, I
Mhm.
mean, maybe that's an area too that we can spend some money on. So those kind of one-offs, if you will.
Yep.
Yeah.
And I don't know if anyone knows that, just coming from the broadband perspective. I know Barrytown School sent everybody home with a MacBook.
Mhm.
I have heard that a lot of schools have done that, but
There,
I
there,
don't know. I don't know if all schools have. I don't know. Is there a gap there? There's
well,
definitely a gap in paying for the service.
Yeah. There you go.
right. The Agency of Education does have access to some federal dollars that are not available to others. The ESSER funds and others that we've been looking at. So the technology piece for schools is may actually that may be there. So coming through AOE. Uh, the question would be if there are other special needs at home for other technologies. I don't know. Ruth, just go ahead. Yeah, I
Okay.
knew you got your hand up. Just chime in. This is good.
So I just want to respond to a couple things because from just quickly on the technology thing, I think you're absolutely right, Senator Lyons, that there's a lot in the education area that is covering that. Most school districts have sent home Chromebooks or some kind of laptop-y device for most of the kids. And in finance, as Senator Cummings knows, we recommended some like re-upping the hotspots that schools are using and doing more with line extensions and stuff. So I don't know that technology is one of the areas that we, as this committee, should focus on specifically. But I do agree with Senator Hooker that these one-time payments for these families, even if they are only one time, can have a lasting effect of bringing them out of poverty because they can pay for back things that they haven't been able to afford. There is a lot of money in the federal funds that are coming. And so I guess it sounds to me like this bill, H315, does have some one-time payments for these families. And I guess what I would say is let's support that and make sure that that stays in the bill and then come back to it in the big bill after we have a better sense of what is available in the federal money. Because I think a lot of the federal funding, is my understanding from what I've been reading, includes a lot of one-time payments to various types of individuals. In terms of the long-term care facility stuff, I completely agree with Josh, Senator Terenzini, and I'm wondering, however, if we could get some testimony from Dale. I mean, I'm looking at the Cathedral Square letter and it's not very specific. And I'd like to get broader testimony from the statewide perspective on the types of facilities. There are a lot of different kinds of these facilities and what they might specifically need. I'm not entirely convinced that the housing money will meet the needs that they might be having immediately. I'm just
So
trying to respond.
I hear you, but okay. Listen, the letter does reflect statewide needs, but we can get more specific dollar figures. The issue here is it's an immediate need, and it will carry these uh, homes over, whichever ones can be carried over. Remember, the question I asked was about the housing money and whether or not the rental piece can be effectively used for long-term care facilities. So that's what Stephanie will research. That we can't. I don't think there's sufficient money in there or time to do the dig deep that you're asking for, and that is to look at the state all the detailed needs. But that is something that we can do next step. So that would be next. I think right now, from my perspective, we should just look at what we can do within this. I think a pretty small amount of money to cover
Well,
the
I
needs that are
understand
there.
that. And if the housing is part, it can be part of that. If what Stephanie finds out, that's great. But I'm assuming that Dale has some more broader information on the impact on these facilities.
Mhm.
And then like I said, the mental health, housing and facilities piece, I think we should try to put more money than the 4 million into that, because that's the perfect use of one-time funds. And
You're talking about capital. Are you talking about the capital piece? Yeah.
There's
I'd
4
love to do
million
that.
in there now. And it seems to me, based on what we've heard, there's so many more needs. And it's one-time funding. It's perfect for one-time funding. And then finally, I still did not hear testimony specific to substance use and what might be needed. I mean, it's a co-issue with mental health for sure. Obviously it is, but I didn't hear, and both Cheryl and I asked a couple times, and so I don't know if we have other people who could come in and speak to that or what, but
Okay, so we can try to get at that. The Department of Health, ADAP, has an RFI going out, and there is a conversation going on about that. It's relatively young. So whether that's something that fits in with this bill or not, I think probably it will fit better next step, to be honest with you. And obviously co-occurring disorders are an ongoing issue, but so Senator Comey, go ahead.
Yeah, I just skimmed the letter from Cathedral Housing, and their base problem, and it's one I heard, I think it was like 3 days before we got sent home from one of my local nursing residential care homes, is the
Yeah,
base
that's
Medicaid. It's the Medicaid rate,
That's the second
$77 a day.
paragraph.
She said you can't rent a sleazy motel for $77. Never mind get 3 meals and nursing and housekeeping services. It is a totally unrealistic, and we're getting all this extra Medicaid money.
6.2%, right?
Yeah. So where is that going? And the Medicaid rates are also a big part of the issue with the designated agencies.
Yep.
And to me, those rates need to go up. I mean,
So-
you can't expect someone to be cared for $77 a day.
No, because it covers more than just a bed.
Yeah.
Right. We all agree with that. And that's the long-term base improvement that we need. And ever since I've been in the Senate, we've been pushing and pushing and pushing, and we might get a little bit here and a little bit there, but you're absolutely right. The next paragraph is about what we could do as a holdover, because during COVID, these homes have lost a population. So the result is they don't have money coming in. So it's lost rent, essentially. It's lost payment to the business. So my question is, how can we provide some emergency, immediate, fast track infill for that? So that was that third paragraph that's in there.
And
So go ahead, Cheryl. Senator
and
Hooker.
they also mentioned like PPE supplies and the
Yeah,
increased cost of there. So it is COVID related. So, you know,
totally COVID related.
Yeah,
It
that
is.
all is.
That all is. So not the base differential, not the $72, not the $40, whatever, but it is the COVID related expenses that need to be, I think there needs to be something in there. So we'll definitely, we'll put something in our letter on that, and we'll try to get some more specific information that will support the amount that's needed. I don't think we need to bring in full testimony in the committee, but we certainly need to ask for some data. And then in terms of the, I think obviously recovery has been an issue. Recovery was not well represented this morning. I think Vermont Care Partners does an outstanding job in its area, but some of the recovery centers are separate from that. And we did hear from folks on that. So we'll try to, unless I hear differently from you, I think we'll try to make some recommendations on some one-time funding for the increased need that these centers have seen during COVID. But go ahead.
I'm just wondering, so one of my constituents asked me that we just got $1.5 million or recently from the opioid settlement with one of the pharmaceutical companies. Do you know where that has been appropriated? Or maybe we can ask Stephanie that question.
That
Or-
actually is an Attorney General's office question because that goes to the AG's office, and we'll have to find out what will happen with it.
Okay, because that's at least a small source of money that seems appropriate for
We would
recovery.
think, one would think, one would think. Okay, all right. Jen, are you there? There you are. So, Jen, you missed some terrific testimony this morning. We looked at H315, the fast track bill, and I don't know who's following that from within Ledge Council. I know there's a lot of mental health stuff in there, a lot of Katie McClin.
Right, so I think I drafted the language that House Healthcare had proposed, including the mental health language. Katie drafted language that House Human Services had proposed. I don't remember the topics
Reach out.
there.
Yeah.
Yes, okay, if there's reach up or childcare, things like that. So
Yeah.
If you're looking to make changes, we would probably continue to staff our own sections, but it was an appropriations committee bill, so it's.
Well, I don't think
like
I'm
that.
not sure we're interested in direct language changes, but rather some policy recommendations.
Okay, in
letter.
what,
A
a letter,
letter.
okay.
A letter, yeah, we're looking at a letter. So, and so what I might do is take some time to put together a letter with you, and then we'll bring a letter back to the committee, and then we can fine tune it. I think it's a better way than just trying to go through everything in the broader committee. But I think we've landed on long-term care as an issue. We continue to be concerned about recovery, and I'm hearing that reach up is important to people. Is that true? Okay. Adding in the diaper dollars, $80,000 more or less. I do have a letter somewhere on that, and I'll get it up on our webpage.
Housing.
And then I know the base funding issue is huge. The question about capital expenditures, that is so important, and we did put capital improvements into our parent-child centers last year. And I'm wondering if, as we go forward, we can find some federal dollars in the next whatever $1 billion we're getting for that.
Do you think there's some that may be specific to capital expenditures in the federal legislation that's in Congress?
Yes, that's what I thought. So that's difficult to hold off. If there's something in the request that Vermont Care Partners has made that we think should go forward, take a look at that list. I know, Ruth, you were very passionate about that, but look at that list and see if there may be something that we might recommend that doesn't eat up all of the money.
Well, there's 4 million already in the bill, and
Well,
and I think if we can find more to put toward that, we should. I mean, their total request is 16.8 million. So
right, I know.
It's unlikely we'll get that far, but doing more.
There isn't that much. It isn't that much.
Well, the
Okay.
bill is about 49 million, and
Right.
we have more than that. So to spend.
So how much do we have?
Well, there's 200 million in general fund that was, sort of one-time general fund money that was, and plus there's the leftover CRF. So it depends who you ask, Cheryl.
Yeah, it's hard to pin it down. It's like a
But we
little
have-
octopus under a cup.
So
We have more than 49 million.
we certainly,
Right. If you look at the spreadsheet that we have that came from the House, you'll see the distribution of about $49 million. You'll see that of that, there is $13 million that is CRF funds.
okay.
No, I
So
think
the
the
cons-
13 million's in addition to the 49. It's 13 CRF and 49.
Yeah,
general fund.
I said that wrong. You're absolutely right. So, but $13 million is CRF. The concern is utilizing general funds for making sure it's one time. Will it raise the bar in terms of base funding going forward? And I'm not going to try to get into the heads of the appropriations folks. That will be a discussion that they have. But I think we can look at what is on the list and what is in the spreadsheet, and then make a decision about what we believe is important. So,
The capital expenditures are certainly one time. So, any.
they are, but when you make, if it's a repair, yes, that's true. But
Right.
if it's a new building and it needs support staff in it, that's false. So, so the balance there is
But I
which,
can
yeah.
certainly see a connection with the VHIP program that,
Uh-huh.
giving landlords the money to rehab their houses so that the stock is available, and then whatever we need to do with agencies, the designated agencies, and things like pathways to sustain it is, then another question. But just to do the rehabbing so that this housing stock is available seems like a good use.
Yeah. And I did have a meeting where we discussed that issue specifically, and how to guarantee going forward that the housing is maintained for the purposes that
Mhm.
we intend. Okay, so here's what I'm going to ask. My ask of you all is to go through the bill, the testimony, and I'll try to get some additional information on long-term care for us. What we haven't talked about is are the primary care needs that we heard about, where primary care practices are in jeopardy, and whether that is a fast track issue right now to increase a stabilization funding, or whether it is the next step. I think is something we need to consider. So that's another issue. The other issue that isn't here is the issue around mental health in schools. Education is dealing with that. We have worked with them in committee, Senator Hooker, Terenzini, and I. So yeah, there's a lot. So make your recommendations. We'll try to put a letter together. I'll try to put a letter together with Katie and Jen, and then we'll put it on the table and look at it together. Add, subtract, improve. Okay? Yes? No? Yes. Yeah. Okay. All right. One more time, long-term care, recovery. Hold the line on some of the things that we're seeing. The Vermont partners, care partners have offered recommendations. Look through those and see if there are some of those that you think would offer improvement to the policies that are currently in the bill.
And reach up.
Reach up. Anything else? It's a sad day when you think that 65 to 70 million dollars isn't enough. But it's not. Okay. We're good on that, I hope. I'd just like to take a minute to go back through S24. Our goal on Friday will be to make any changes that we think need to be changed, and move the bill out of committee. There are two ways we can move the bill out of committee. One is to just simply vote it out. Then it sits on the calendar, and then it goes to economic development, and then it goes to finance. The other thing that I'm thinking about is after we've had our discussion, simply to relieve our committee of the bill and send it to economic development where it originally had started. And I've talked with Senator Sorokin about doing that, and he's fine with that. All right, Jen, do you want to just quickly remind us of what S24 includes?
Sure, that would be helpful.
All right, yeah, it would be.
Are you wanting me to put it up or just describe to you what's in it?
Let's put it up.
And Nellie has also put it on your committee page if you're interested in pulling it up.
And I will tell you, I understand that the Vermont NAACP is sending us a letter of support for the bill, and there are others who are similarly positioned who may also be sending us letters of support. So we'll see that.
Okay. So for the record, Jennifer Kirby, Legislative Counsel. This is S24, an act relating to banning flavored tobacco products and e-liquids. It starts out with a number of findings, which I'll just scroll through here. And then it updates the definitions in the first case here. In the definition of tobacco products is really to remove some ambiguities and inconsistencies with the definition in the tax statutes. And then also make some changes to the definition of tobacco substitute, which is the statute's term for electronic cigarettes and similar devices, so that it's a little bit broader and captures some emerging products. Then we have the definition of e-liquid, which is the solution, substance, or other material used in or with a tobacco substitute that is heated or otherwise acted upon to produce an aerosol, vapor, or other emission, to be inhaled or otherwise absorbed by the user, regardless of whether it contains nicotine. And so then you'll see the e-liquids term being either introduced or used to replace some various other terms throughout some statutes. Starting with the first, this next one here, which is the license required to sell these products. Same thing in this next section, also including tobacco substitutes and e-liquids in this exception about where items can be displayed. Then the proof of age statute, again, adding e-liquids in here. 7 VSA section 1005, this would remove the penalty for possession of tobacco products by minors. So it would then just prohibit the purchase and the misrepresentation of age for purchasing.
Jen?
So what we've, sorry, go ahead, Ruth, and then I'll ask mine.
On page 8, line
Yes.
13,
Page
it's a
8.
very specific question. The sale and purchase of bidis.
BDs is my understanding of the pronunciation.
Okay, what is that?
Well, happily for us, it is a defined term in statute, so I'm going to have to pull it up and tell you what it is. But in the beginning of this chapter, 7 VSA chapter 40 in section 1001, BDs, and there's also another spelling, BEEDIES, means a product containing tobacco that is wrapped in tamburni leaf, and then parenthetically it says Diospyros melanoxylin, which I'm probably butchering, but or tendu leaf, Diospyros exculpra, or any other product that is offered to or purchased by consumers as BD spelled this way and BD spelled the other way.
Ah,
That is the extent of my knowledge.
okay. I've never heard of this thing. Okay, thank you.
Yep. Well, you're not allowed to sell or purchase them currently.
Okay, will do. Will don't.
All right. Well done. Yes. Great.
So I was gonna, that was exciting. Thank you, Senator Hardy. I do remember a previous conversation about that, but I'm glad you brought it up. Not this year, another year.
Yes, this particular language has been in the statutes longer than I've been working on tobacco stuff,
Yeah.
which isn't all that long, but it's been in here a while.
So we are taking out the penalty for possession.
Yes, this would get rid of the $25 penalty for possession, which is in here somewhere.
All right. I
Yes,
think
there we
this
go,
is-
in here in
yeah,
B. So it
Yeah.
gets rid of the civil penalty of $25 civil penalty brought by the Judicial Bureau for possession. It does maintain it for purchase.
Okay. This is an area that I think economic development, well, they have a bill on PUP, purchase, use, and
Right,
possession.
they do have a bill, and actually in that bill, it would, I don't know if it's decriminalized, because I don't think it's criminal, but unprohibit the possession of BDs, because it is getting rid of
Right.
all prohibitions on possession. So at least as introduced, it would allow for the possession but not purchase
Okay.
of BDs. All right, section 1006 is adding the e-liquids to the placement of posting of signs in retail establishments. Section 1007 adds the e-liquids to the prohibition on and penalties for selling or furnishing products to minors. And then goes into the compliance testing, and then updates and corrects the name of the reconstituted Tobacco Evaluation and Review Board, which became part of the Substance Misuse Prevention Oversight and Advisory Council, along with some other boards and councils. Section 1009 makes some updates to the contraband and seizure statute to pull in some of the pull in some conforming changes with other or provisions with other statutes. So it would have the contraband and seizure provisions apply not only to cigarettes and tobacco products that were sold, offered for sale, or possessed for sale in violation of certain statutes, but also would add tobacco substitutes and tobacco paraphernalia, and then would add this new e-liquids language as well, and also reflects some of the other sections that prohibit or place limitations on the sale and possession for sale. And then makes a conforming change down here to incorporate all of those items. Section 1010 is the internet sales provision, and it corrects that or changes that definition or that language around the e-liquids. And also adds some of the other types of products into what constitutes a separate violation for separate shipments. And we get to 1012, which is currently liquid nicotine packaging, and instead using that new terminology around the e-liquid for consistency. And then finally, we get to the new section here, 1013, on the flavored tobacco products, flavored tobacco substitutes, and flavored e-liquids being prohibited. And there we have the definitions. So the characterizing flavor, the flavored e-liquid, the flavored tobacco product, and the flavored tobacco substitute, and the tobacco retailer. Then it prohibits anyone from engaging in the retail sale of any flavored tobacco product, e-liquid, or tobacco substitute. So again, here it's not the possession, it is the retail sale. It's not even the purchase, it's the retail sale. No retail sale of any flavored tobacco product, flavored e-liquid, or flavored tobacco substitute. And if a retailer or their agent or employee violates the section, the retailer would be subject to a civil penalty, like the penalties for the sale to minors. And it would be, again, brought in the Judicial Bureau. That's what it means to be brought in the same manner as for a traffic violation. Then it gives the Judicial Bureau jurisdiction over that new offense, and also revises the language of the minors to be purchase and not possession. Then we get into some conforming revisions elsewhere in the statutes. So this is an existing statute elsewhere in Title VII that talks about the penalty provisions that apply to other types of products, not applying to violations that are dealt with separately under the tobacco statutes. And so adding e-liquids there. Adding e-liquids to the prohibition on the use of certain products on public school grounds. Adds it also to the language around the substance misuse prevention, oversight, and advisory council. And makes some conforming changes in the tax statutes definition as well. It's my understanding there's no actual policy implication here, but using this same e-liquid language and also just making some grammatical changes in that definition. Then Section 8 would have the Office of the Attorney General report back on whether and to what extent Vermont can legally restrict advertising and regulate the content of labels for electronic cigarettes and other vaping related products. That has been an issue of interest to a number of people, and there's a lot of complexities around the federal law, federal preemption, and case law, including constitutional issues. And the act would take effect on September 1st.
Okay.
Can
Go
I ask
ahead.
a question? So just in general, this bill would, everybody moved,
Sorry.
would get rid of the violations about possession of tobacco products. But what about purchase?
So it would not allow, it would continue to prohibit the purchase by minors. It does not address the purchase of flavored products. It prohibits the sale of flavored products.
Okay, so the sale of
Or the
flavored
retail
products,
sale.
the
I should be
retail
specific.
sale of flavored products, and that would include internet sales as well?
So these products are not allowed to be, are already not allowed to be sold online direct to consumers. That was something you enacted, I think it was last biennium, maybe
Okay.
last year, last biennium.
Okay,
So nobody can ship products ordered online to anyone other than a licensed wholesale dealer or retail dealer.
okay. So for regular, quote unquote, regular cigarettes, non-flavored, just the run-of-the-mill cigarettes, it's no longer, this bill, according to this bill, there's no longer a violation for possessing them, even if you're
By
under-
minors, right?
by minors. But purchasing by minors is still illegal, or there's a,
Yep.
that's a, And retail sales to minors is a
Right,
violation.
still not allowed. That's
Okay,
right.
Okay, so it doesn't do anything with the purchasing, and that's something that the other committee is interested in looking at potentially, or has a bill that's related to. Is
Right,
that
there's a purchase, use, and possession, some people call PUP, purchase, use, and
Right.
possession bill that is in the Economic Development Committee.
Okay, but this one only deals with possession, not purchase and use, or I'm trying to figure that.
Right,
This is just possession.
this
Okay.
is just possession
And
for
retail
minors
sale of flavors.
and retail sale of flavors.
Okay, got it. All right, thank you.
Okay, good. Other questions at this point? I mean, we have been through the bill previously. And I do have an interest in how folks are feeling about the bill at this point. And I don't know if you want to do a little show of hands who supports passing the bill out of committee. That would help me.
I have a
Oh,
question, Ginny.
yeah, go ahead.
With your other choice of sending this bill to economic development again,
Oh, well, I still want to know how
I
my
know.
committee feels about the bill.
question is, do you anticipate them including, kind of melding the two bills, their bill on?
I don't know, Senator Hooker. They may or may not. I think it would be I think it would be very useful to have that happen.
Just
The PUP provisions are kind of anachronistic, and they capture people for doing something that, I think as Senator Cummings and I have talked about this, and it's the kid driving down the highway smoking, being pulled over for smoking a cigarette, and especially if it's a BIPOC person, you have concerns about that.
okay.
Oh. Go ahead, Senator Cummings. You're muted.
So as long as I'm muted, I can't chime in. I voted for this bill last year with reservations. The most reservations were around the sale to adults of flavored tobacco, and that includes Grandpa's cherry wood pipe tobacco. We did this prior to COVID. It was sitting, waiting for next week in finance. And since that time, who we didn't hear from this time to anywhere near the extent we did last year were the adult users of vapes and people that use vapes to step down. And it's debatable, but there were a significant number of people. We had one retailer who was a firefighter and decorated and everything in his hometown, who has moved his smoke shop to New Hampshire and is presently servicing all his Vermont customers a mile away. This time, I'm not going to be able to support the bill with the ban on menthol. I really have a problem. History. One of the reasons I voted for the cannabis bill was the testimony of teenagers that it was easier to get cannabis, i.e., there was always somebody in the parking lot, than it was to buy alcohol, because you had to get an adult to buy it for you. We admitted when we did that bill, not that it was a good thing, and it most certainly is not going to be a good public health thing, but because prohibition didn't work. All prohibition of alcohol did was create a huge explosion in organized crime. Vermont being, Lake Champlain being one of those conduits. I don't see that prohibiting adults from making bad choices is going to stop them from making bad choices. It will just make them find other ways. My other concern is we did this bill pre-COVID. I assume all of you were getting the pushback on mask wearing, pressure to get vaccinations. We have asked more of people. We've asked people to give up more in the last year than we have since World War II, at least, in the way of, things you just can't do for the public good. I don't think this is the time to tell them when their stress levels are up and they've been making sacrifices for the public that now we're going to take away your menthol cigarettes that you, by the way, are totally addicted to, and tell you that you've got to smoke nasty flavored tobacco. And I just think the timing is wrong. I think people, and there's nothing in this to increase prevention or cessation services. I mean, we're taking a crutch away and we're not putting a cane in there for folks. So I have great sympathy, and I will take anything away from kids. I have a concern kids are going to move down the table to cannabis or back to pills, but I just don't feel this is the right time to do it. And I've changed on this one.
Okay, thank you, Senator.
West.
Well, I do want to say that if we look at the testimony that we've heard, we understand that that COVID has increased the use of these things and the public health crisis associated with it. We've also heard that kids are getting this so easily, everything from we don't know where, but they're getting it. And in our conversation,
Find it in Vermont.
they're getting stuff
Getting it, but they're not
over the internet, is what we have heard from kids.
They'll
coming
keep
in.
getting it there.
So I'm the
Yeah, I haven't heard.
that when a child begins this process, they become addicted, and they become adults who are addicted.
Mhm.
The issue around flavors is something that the cannabis bill took up and specifically banned flavors for the same reason that we are interested in banning them here. 30% of the cannabis tax revenue will go to prevention, and that will include substance use disorder prevention overall and nicotine. So we can agree to disagree on the timing of this, but in terms of our awareness of public health, it's never been higher than it is now with COVID. So we hear you, Senator, and I understand that there are some passionate people out there who believe that menthol is helping them quit. The data and the supporting evidence is just not there. It just makes it easier to smoke because it feels good. But so we're actually over our allotted time today. I do want to give everyone a chance to kind of weigh in. We'll come back to this bill on Friday very briefly, and then we'll deal with it. And see how it goes. I see one vote against the bill, and it would be helpful for me to understand how the full committee feels about the bill. Obviously, I'm going to support it, and I'm willing to listen.
I have to go to money chairs.
Yeah, we have another meeting too, but Senator Terenzini, go ahead.
Well, out of respect for you, Senator Lyons, and the committee, and I can give my reasons as well on Friday. I know that we're over, but I too will be a no vote on this. And like I said, I want you to know today versus waiting till Friday that I'll be a no on it. So, you understand the sort of the pulse of the committee. So.
thank you. Appreciate that. So, all right, so let's call it a day. And tomorrow we meet. I'm sorry to do this to you, but 8 a.m. We're gonna have fun. We have a full day of testimony on S20, and it will be a full day on PFAS. We'll
Okay.
we'll see. I'll see you all then. Thanks for hanging in there today. I think we've done a
Late.
lot of good work.
Just a
Appreciate
reminder
it.
that I'll be late.
Yes.
Yeah, Jenny, again,
Yes.
I'm dealing right now with palliative
I
care.
understand. I
Okay.
understand. I
I'm not, and
understand.
I can't get a time. So.
Nellie, we can